So there's this incredible, almost science fiction procedure where doctors can actually pull a blood clot right out of an artery in someone's brain. It's a total game changer, literally saving lives. But what happens next? What happens in those critical hours and days after the clot is gone? Well, that's when a whole new race begins. A race to watch, to detect, and to manage the brain's incredibly delicate recovery. And to get why this is so important, you just have to look at the numbers. According to the American Heart Association, we're talking about 795,000 strokes every single year in the US alone. That's a huge number. And the vast majority of these, they're what we call ischemic strokes. And that's exactly what we're digging into today. Okay, so what is an ischemic stroke? Take a look at this image. You're seeing this incredible, intricate network of arteries in the brain. Think of them as vital pipelines. An ischemic stroke happens when one of those pipes gets blocked by a clot. It cuts off the blood supply, and that starves a part of the brain of the oxygen it desperately needs. It's basically a critical plumbing disaster in the most complex organ you've got. Right, so when that blockage happens, it is an absolute emergency. I mean, we are talking about a race against time, where every single second counts. For every moment that blood flow is cut off, more brain cells are dying. So the number one goal of any modern stroke treatment is to get that blockage cleared out as fast as humanly and technologically possible. And one of the most amazing, truly game-changing ways to do that is a procedure called mechanical thrombectomy. This is where doctors become like these super high-tech plumbers for the brain. They can actually navigate through your arteries to physically grab that clot and pull it right out. So how on earth do they pull off something so incredible? Let's break it down. You know, the concept is both incredibly complex in execution, but almost beautifully simple to understand. First, they thread a tiny, flexible tube, a catheter, through the body's arteries, navigating all the way up into the brain right to the clot. Then, this little device called a stent retriever is pushed through the clot. And here's the cool part. It expands, kind of like a mesh cage, and it traps the clot inside it. And then, very carefully, the doctor pulls the whole thing, the stent and the captured clot, out together. Just amazing. And wow, this slide right here shows you everything. Look at the top image. You see that blockage? It's a total dead end. But then look at the bottom after the procedure. The artery is wide open and blood is flowing freely again. The goal here is something doctors call reperfusion, and it just means getting that vital blood flow back to the brain tissue. But here's the thing, getting the clot out, that's really just step one. Now, the supercritical monitoring phase begins. Doctors immediately start looking at follow-up scans. And what's interesting is that some of the things they're looking for are actually expected, totally normal signs that the procedure went well. Yeah, one of the most common things they see is something called contrast staining. See, during the procedure, they use a special dye so they can see the arteries on the X-ray. Sometimes, because the blood-brain barrier gets a little leaky after a stroke, some of that dye can seep into the brain tissue around the artery. It shows up as this bright spot on a scan, which might look alarming, but it's usually totally harmless and just fades away on its own in a day or two. So the big question is, how do doctors know for sure it's just harmless dye and not, a bleed? Well, they use some pretty amazing imaging tech. The dye they use has iodine in it. And with a special CT scan, they can digitally subtract the iodine from the picture. So look here. In image C, you see that bright area. But in image E, after they do the subtraction, poof, it's gone. That tells the radiologist, okay, we're good. This is just staining, not blood. But, of course, they aren't just looking for the good signs. This is where radiologists really become detectives. They are meticulously searching every pixel of that scan for any hint of a complication. Anything unexpected, anything potentially dangerous that needs their immediate attention. And they have a system for this. Complications are generally broken down into two main categories: intracranial, which means anything happening inside the skull, and extracranial, which are problems that could pop up anywhere along the path the catheter took to get to the brain. And when we're talking about what's happening inside the skull, the number one most crucial job is telling the difference between that benign contrast staining we just talked about and a true hemorrhage. A hemorrhage means active bleeding in the brain, and that is a very serious complication because it can cause swelling and create pressure, which can do even more damage. And this slide just perfectly illustrates that challenge and the high-tech solution. Look at image A. It's just a mix of bright spots. It's hard to tell what's what. But then in image B, they use that iodine-subtraction technique. The contrast staining vanishes, that's the area with the blue arrow, and what's left behind is the real bleeding, marked with a red arrow. This technology is absolutely critical. And even when there is a bleed, they're not all the same. There are different levels of severity, and doctors classify them to figure out the best way to treat it. So a petechial hemorrhage, those are just tiny little specks of blood. They don't cause any real swelling. But a parenchymal hematoma, now that's a bigger, more contained bleed that does create pressure. Doctors call it a mass effect, and unfortunately, it's often linked to worse outcomes. Okay, now let's walk through what happens when one of the most severe, though thankfully rare, complications occurs. This is called an iatrogenic vessel perforation. It happens in less than 5% of these procedures. Basically, it means that during the procedure, the wall of the blood vessel was accidentally torn. What you're seeing in this angiogram is the dye actively leaking out of that artery and into the brain. And the immediate result of that tear is this: a massive bleed, a huge hematoma that you can see on this CT scan. It's so big that it's causing what's called a midline shift. It is literally pushing the two halves of the brain off center. That kind of pressure is incredibly dangerous, and it can absolutely be fatal. So to save this patient's life, surgeons had to rush in and perform an emergency procedure called a decompressive hemicraniectomy. It sounds complex, but what it means is they temporarily remove a large piece of the skull. This gives the swollen brain room to expand, which relieves that deadly pressure. This follow-up scan shows the result of that incredible, life-saving intervention. And beyond a major bleed, like that one, the monitoring team is constantly on the lookout for a whole list of other potential issues. They're checking to see if the artery clots up again, which can happen, or if tiny bits of the original clot broke off and traveled deeper into the brain. And their search isn't just in the brain. It extends all the way down the path the catheter took, looking for any vessel damage or bleeding where it was inserted, usually in the leg or the arm. And all of this, it brings us right back to the most crucial point of all. The work isn't done when the clot is out. No way. In so many ways, it's really just beginning. It really all comes down to this. Success isn't just about that one incredible, dramatic moment of pulling the clot out of the brain. Real long-term success is all about the meticulous, high-tech surveillance that comes after. It's about managing that incredibly complex path to recovery and catching any tiny problem before it turns into a catastrophe. Look, mechanical thrombectomy has absolutely revolutionized stroke care. It's turned what used to be a death sentence into a real chance at recovery for so many people. But as you've just seen, that journey after the procedure is incredibly complex. So the big question for the future is this: how can we push the technology even further? Not just to treat complications when they happen, but to maybe, just maybe, help us predict who is most at risk before anything bad happens at all. That's the next frontier.